We're gonna get started. So for those of you who remember Michigan time, this is sort of a modified version of Michigan time. I'm Tom Buckmuller. I teach in the Ross School. I'm a health economist. And I'm so happy that ISR is hosting this event on such an important topic. We all know that misinformation is a growing part of our lives, and it affects public policy in so many different domains. But I think misinformation in health and healthcare is so concerning because, as the title of the book suggests, it can actually make us sick. So I'm so pleased that Joanne, Kenen, and Josh Sharfstein could join us today, braving tornadoes, sleeping in basements, going without power, charging their phones wherever they can find electricity.
It's basement.
But it's great that they're here. Over the years, I've brought a group of students to Washington, D.C. to learn about health policy, and Joanne always speaks to my class. So when she said she was on a book tour, I said, oh, you definitely have to come here. So I'm so pleased that they're here. Joanne currently is a journalist in residence at the Bloomberg School of Public Health at Johns Hopkins. And she's also a contributor to Politico magazine, and for a long time has been involved with Politico in different ways. And before that, she covered Capitol Hill and health policy for Reuters. You can also hear her periodically on the What's the Health podcast. If you don't listen to that, you should. It's a great source of information on health policy. The tagline is that it brings together the best and smartest healthcare reporters in Washington. And as a regular listener, I can tell you that's true. It's a terrific show. Josh is also from Johns Hopkins, Bloomberg School of Public Health, where he's a distinguished professor and also the vice dean for public health practice and community engagement. And in addition to his distinguished academic credentials, he has an impressive history of public service. He served as the Secretary of the Maryland Department of Health and Mental Hygiene, the Commissioner of Health for the City of Baltimore. He was a Principal Deputy Commissioner at the FDA and a health policy advisor to Congressman Henry Waxman. Now, I have to confess, I have not yet read the book. I was hoping to score an autographed copy today. But I'm so pleased to have them here. And I'm interested in hearing their diagnosis, but I also am pleased to see the title book suggests that they're going to suggest some treatment. So I'll turn it over to you two, and thank you so much.
It's quicker. They said if you hit this one, it turns it off. Just hit it again. Okay. You're more likely to do it by mistake than you.
Great. So I guess we can see it here, so we could sit here. Thanks so much, Tom, for inviting us and for the really nice introduction. And it's great to be here. I just wish that you guys were more in a celebratory mood after the basketball game. It's hard to find anybody talking about it or selling things about it. Well, we're going to jump in. Joanne and I have known each other a long time, and we taught a class at the School of Public Health on these themes for a while and decided that it would be worth writing a book. And we sent it in like over a year ago, and it came out recently. So we were kind of envisioning the direction of things. But as you'll see, there's still plenty to be talking about things that have happened since even we wrote the book. And the starting place for us are the headlines. And it doesn't take too long to find a headline that we would call like a head scratcher, where people are getting information online and actually suffering as a result of it. There are people who are turning down chemotherapy for cancer in order to try untested treatments. There are people who are doing coffee enemas. I'm not even sure what that is. There are all kinds of headlines like AI has confabulated report of citations in an major HHS report you wouldn't expect to see. And then you have consequences like people who fall into vaccine disinformation, not getting vaccinated against COVID and dying. We tell a bunch of these stories in the book. Most recently, Chuck Norris's family warns of AI-generated videos spreading fabricated reports about his health before death. I mean, again, a headline that I wouldn't have necessarily predicted, but this is the world we're in. Any topic can be distorted. People can be misled about so many different things. And so our book is called Information Sick. And in this brief talk, overview of the book, and our perspective, we'll talk about the causes of this condition, the symptoms, the diagnosis itself, what do we mean by information sick, the treatment, and then some instructions on maybe what we can individually do. And so I'm going to turn over to Joanne, who is going to talk about some of the causes, and then she'll turn it back to me. I'll just say one major insight I think that we had is that it's not just social media, and it's not just the loss of journalism, and it's not just the polarization and confusion in society. It's all those things coming together that really creates the challenge.
I think those of us who were raised in cities or on the coast underestimate the importance of local news, and local news is vanishing, and yet it's still trusted. So when it vanishes, source of trusted news goes away. This is Eric Iyer, who happens to be a friend of mine, but more important than that, he worked for many years. He's a really talented national award-winning journalist. He could have gone anywhere. He and his family loved Charleston, West Virginia. They wanted to stay there. It was the paper there. It's small. It's Charleston, West Virginia. It was a family-owned paper for about 80 years, and they put money into good journalists. Eric would get months to work on investigative projects. About roughly 10 years ago, Eric was the reporter who really who uncovered what the drug distribution companies were doing, dumping millions upon millions of opioid pills on small communities throughout West Virginia and nearby states. He won the Pulitzer Prize, which is a big deal, particularly from a smallish newspaper. And about 4 or 5 days later, the family who had owned this paper and struggled to keep it going for approximately 8 decades said, we can't do it anymore. We've got to sell. So they sold it to a chain. Eric and almost everybody else good left. It's sort of apparently reconfigured a bit, but it isn't what it was. And there's stories like that, not quite as dramatic, but it's very emblematic of what's happened in local news. For really generations now, for decades, we've been hearing about what today we call disruptors. I don't think they call radio a disruptor, but that's what they would call it now. Things that were going to destroy news, and yet news survived. Back in the 30s, people, they didn't stop reading papers. They listened to radio and read the paper. You all heard stories about FDR and people gathered around the fireside talks. TV in the 50s and 60s did start to kill off afternoon newspapers, which some of you probably know was didn't even know was a thing. But afternoon papers started closing in the 50s and 60s, and they barely exist anymore. But the morning papers struggled along. And then technology did become the disruptor. When things like Facebook Market and eBay and Craigslist, people stopped putting classified ads, which were little tiny, some of you remember them, some of you never heard of them. They're little tiny ads. And before there was Craigslist, that's how you sold your old bike or bought your new bike, rented an apartment or bought a car. And they were a huge source of revenue for newspapers. They were inexpensive for individuals, but there were so many, they were a big source of revenue. They went away because of the technology. There were also some other changes in advertising and stores and so forth. But what really killed newspapers is obviously our phones, right? I mean, why sit at your, this big thing, a newspaper, when you can get what you need on your phone? And then originally it was for free. It went from monopoly to franchise to competitive toast. That's what Warren Buffett said. He had bought some newspapers and decided, not as a philanthropic, he does a lot of philanthropy, he bought them as a business and realized that was a stupid thing and dumped them. And they're going to disappear, and they are disappearing. Local newspapers are disappearing. They are anything on that map with either a yellow or red square is a county that either has 0 or 1 paper, and that 1 paper might be only a weekly 4-page. And this map is actually 4 or 5 years old. They've changed their methodology, and they don't have such a pretty map, but it's gotten worse. Those are called news deserts, the areas of part of the country that does not have any source. Meanwhile, private equity has been buying some of the mid-sized local papers that aren't little tiny ones like Eric's, but are in cities like Chicago and Baltimore. They were important. They weren't national the way the Times and the Post are, or in the case of the Post, maybe about to be were. But they had significance. they were nationally influential, but they were sort of locally based. So they got bought up by private equity. When most of you know what private equity does, it sort of sucks up what has value and then tries to sell the bones. Any paper, pretty much, there are rare exceptions. Most of those papers are worse off if they're and struggling. Oops. And did I skip one? The other thing that happens as local news, there's also a lot of chain acquisition of local news, such as the one in West Virginia. And when the chains buy them, there's less local news. It's cheaper to print or you can have like a paragraph localizing a national story. It's cheaper to print the same story or the same TV segment if you own 50 stations or 50 newspapers. You're not getting as much local news. And they are also tilting more conservative as they become owned by out-of-town owners. There's also fake news. There's real fake news, which is confusing but real. There are local news sites that have been dubbed pink slime after a not-so-real scandal about hamburger meat in public health a number of years ago. Pink slime papers are funded by dark money. There's mostly right-wing money. It's been researched by the Columbia Journalism School. There's some left-wing money, lest you think that only one side plays this game. That's not true. They pretend to be local news sites, and there's not local, there's not news. They're terrible, and reading them and looking at them, we've seen a lot of misleading or outright false health information. The Capitalist is just, newspapers have cut back on covering state capitals. So when the Capitalist appeared I mean the state government, the governor, the legislature, when the Capitalist appeared in Tallahassee, Florida's capital, people say, wow, we have a paper covering our government, but it turns out to have been another form of fake news. It was owned by the utility company, Florida Power and Light. They hid it. They had legislation coincidentally pending about utility rates in the state legislature. And then we have WhatsApp, because we sort of don't know where to put WhatsApp. I mean, WhatsApp is not local in the sense that there are 6 billion people around the world, but they're and they're a form of local networks, right? And for public health, we know that there's a lot of health and vaccine information passed on WhatsApp, but we can't study it. We can't get at it. We don't know what's being said by the nature of it. We do know that there's some reliable good. We know there's bad stuff. We do know that it can, in fact, be used to promote honest, real health news. We had a student who read a really interesting paper one year about his faith community that was, most people would have been skeptical of national media, the Times and the Post, but their community leader, if he put a link to the Washington Post saying why you should get vaccinated, people would say, oh, we should read this because this is good for us. And that community had a very high vaccination rate. So WhatsApp is sort of in a category of its own. And we don't know exactly what its role is in replacing local or national news. When I grew up, we didn't have MSNBC or Fox, but we also didn't have overtly politicized one side versus the other. This is relatively new, less, sort of like maybe 20-ish years. We don't think about it now, but that's the norm. I have Elvis here because I believe that he is the first influencer. Although we have a professor of Russian history here, Professor Kivelson, who's a friend of mine, which is an old friend of mine. One reason she's here, she told me that Catherine the Great let it be known publicly when she had her smallpox vaccine. So perhaps she was the first influencer. But this is Elvis getting his polio shot backstage. It wasn't broadcast. We didn't have that great technology. We didn't have TikTok. But this is a still photograph of the Health Commissioner of New York and the Deputy Commissioner of New York giving him his polio shot. Polio shots, as most of you know, like people stampeded to get their kids vaccinated, not like today. But there wasn't great uptake on teens because people thought of it as a little kid disease, but teens needed it too. And so Elvis had, was like a lot of teen fans. And so this was him getting his shot. And it's hard to prove exactly how much that made a difference. It was generally thought to have been helpful. Teenage vaccination rates went up a lot. And on the other side, these are the NBC, ABC, and CBS in the early 60s. People watched evening news. It was sort of a national unity moment. But and there was something to be said for having a national conversation that is not as fragmented as the one we have today. But it is also important to remember that not everybody was equally included in that conversation. Not only are there 4, white guys, I always say the only difference is some have more hair than others, with mustaches, and not only these are the on-air guys, but the people making the decisions behind the scenes, the producers and executive directors and so forth that look just like them. So yes, it was a national conversation. It was flawed. On TV or national news in general, it's all horse race. It's not just the ideas behind politicians, but it's really who's up and who's down. Astonishing little policy news, certainly on TV network news. There was one study in 2016, and I've not been able to find the comparable one for the guy retired in 2020 or 2024. But in 2016, which was Trump versus Hillary, who was like the empress of policy, as of October, so there were a few weeks left in the election, but as of October, the network news had spent 16 minutes on policy. And the rest of all was, today's poll, who's winning, who's losing. I think that in the government shutdown last year, it was a great example as I watched it. Is Schumer winning? Is Johnson winning? And there was really very little discussion in the media about what those ACA subsidies meant until it was too late, until the government reopened without any change. And that was really a policy issue covered as a political horse race. You want to take it?
Sure. I'll take this. So you have this transformation of journalism, and at the same time, you have rise of misinformation and disinformation on social media, just totally transforming things. And I'm just going to do a quick poll here. Here's the question, and then we'll do a show of hands. The question is, how many people get at least half of their news by going to a physical newspaper or a newspaper website and reading stuff, versus how many people get at least, I'll do the show of hands in a second. The other side is, do you get more than half of your news being basically provided to you in an algorithm through, Instagram, Twitter, X, Blue Sky, all the different networks? Okay, so how many people think you're getting at least half your news, you're going to the site to read about the news? And how many people think you're getting it through the sources you've signed up with for and other algorithms? Yeah, I'm not going to do an official poll here. This tracks very well with age in this crowd and in any crowd here. I'm just going to point that out. And once you get to like 25 to 30, it's almost everybody's getting at least half of their news, and some people are like, newspapers have websites. It's not so obvious. So we're in a world where people are getting information in a very different way. It could be great information at the under certain circumstances, but it can also be quite wrong. And the challenge is that wrong information is incredibly prevalent online, and it moves faster, it's stickier, it's more emotionally engaging. This is a podcast called Tiffany Dover is Dead. Tiffany Dover is a nurse with a fainting problem, who for some reason they picked her to be the first person vaccinated at a hospital in the Midwest, and she fainted.
On live TV.
On live TV, and they moved her off stage. And then the rumor went around that she was dead, because she wasn't dead. She came to right away. But the hospital panicked and never made another statement about her. And so there were like millions of posts and retweets and whatever about her having died. And this journalist went out and searched for her, found the fact that it looks like she's been on vacation with her family based on this, and couldn't find her, did an entire year of podcasts without finding her. And it's like 6 months later, she called her. They sat down and talked about it, but so much confusion over what happened. The number one shared Facebook post in 2021 was "Doctor dies of the COVID vaccine after getting vaccinated," and that was wrong. That was a false statement. And so that's billions of shares, billions of shares. So just to quickly say, when we talk about misinformation in the book and disinformation, we're not talking about subtle questions of like, I've got a new theory of something. We're talking about things that are, flatly wrong. Now, it could be someone's putting it, forward because they don't know any better. They're sharing it inadvertently, but it's not something that is, particularly debatable. It's like the COVID vaccine is making me magnetic, or, the COVID vaccine has killed more people all around the world than it could possibly have saved. And there is a gray area, and we'll talk a little bit more about policy, misinformation as an insult, I think, has been overused by different sides of questions. But we're really talking about things that are clearly wrong and pushing people in a direction that is not healthy. And like I was saying, that there's a lot of science to this. We go through some of that in the book, that we are more engaged with very highly emotional content. And that is really untethered. When it's untethered to reality, you get false information moving around much, much, much faster. So we did this project. I don't know whether these videos will work. We divided our class a little bit smaller than this, but we had two sides. And imagine we were in class and we said to you guys, go find a TikTok video that is a responsible TikTok video on the subject of myocarditis, heart inflammation, and the COVID vaccine. COVID vaccine causes myocarditis at a low rate. You guys go out, you find a guy who looks like him. This is the American Academy of Pediatrics. He basically says, look, it's even more likely that if you get COVID, you'll get myocarditis, you know, and it's like very calmly explained. But then if it's actually not this person, but he's commenting on a video, the other side, go find a TikTok video that is not particularly responsible and so with a lot of views on the same subject. And the team found one of someone who said she was a nurse in a closet saying all the patients in the intensive care unit, their hearts have been severely damaged from the COVID vaccine, and nobody is talking about it. I'm not allowed to report it to the CDC. And what was interesting was not just that this one had millions of views and this one had thousands of views, but that when we were looking at the very responsible doctor explaining the science, none of the students were watching on either side. Like I was looking out at the students and everybody was
No, MPH students. These are public health students.
Well, I mean, it was not that engaging. But when we had the Blair Witch-like video of the nurse in the closet, you know, everybody was riveted to it. You know, it's like, no surprise this has millions of views, but it's not essentially a fair fight online. And this is another dimension to this, which is that systemic failures are fueling this. There's a lot of distrust that comes out of the healthcare system. When people can't see doctors, when they get ridiculous bills, they can't understand. They really are distrustful of everything in health. And they're very susceptible to messages that say, your doctor's in the pocket of the pharmaceutical industry, and you know, only I have the right answer, and there's an underground way to do this. And there's a story in this great book, The Anatomy of Deception by Sarah Gorman, about somebody who is completely distrustful, has these terrible experiences with healthcare, won't get any care for her disease, moves to Norway. In Norway, healthcare is, you know, basically free, low cost for some people, and she gets to go to the doctor there. And suddenly she trusts healthcare again. Then she moves back to the United States. So it's like a challenge, re-challenge allergy study, and she totally refuse to go. And so, you know, we have created a bunch of conditions that make people susceptible to a number of these messages. So let me just, we'll move a little faster here just to say, well, you have this situation. You have this stew of loss of journalism, rise in misinformation, disinformation. Well, what happens? When local news goes away, you have fewer reporters and editors. Used to be I had 5 reporters when I was the city health commissioner in Baltimore just covering the health. And now there's like 1 person doing breaking news who might come to the health. Less awareness of what's going on, more errors. You know, I mean, there are all kinds of errors, and it's not necessarily because people are worse reporters, they're just stretched thin. More false equivalence. You know, I don't have time as a journalist to really look into this, so I'll just say this person says this and that person says that, and you figure it out. And less accountability for the public sector if they can't really be there. When national news is fractured, you get a lot more gotcha journalism, less policy journalism. There's a story in Politico that's been frustrating me and my colleagues.
And I had nothing to do with this.
Yeah, Joanne had nothing to do with it, but the big headline, like Americans turning against vaccines, and it was like one poll, it's inconsistent with a bunch of others. The way the questions were worded were highly questionable, and yet it's just like they want to get the hits, you know, the clicks. Frustrating right now to people. It's not that that's not an important topic to cover, but there are more and less responsible ways to cover that. And
It was the polling rather than.
yeah, well, it's
When I was the editor for Health, we did our polls with Harvard School of Public Health. They did something else this time.
Yeah, so and there's just a bias in the newsroom these days for putting things up that get clicks, that get people's again emotional. They're competing against social media, so it's much harder to get good information. And then you have just a flood of misinformation. And we had an FBI expert in misinformation come to our class one year, and he basically patted me on the head. Said, "It's so adorable that you all in public health think if you just edit that message once perfectly, focus group tested and everything, then people will follow you. That's what the paradigm that you guys bring. You're sending your one little missive out into the world, and it is getting drowned in 100,000 messages. It's crazy that people are getting from all different sources." And then he went on to say, look, there's a clear recipe how to get people to believe misinformation. Half the information you give them is true, half of them is not true. But the half that's true gives them confidence in what you're doing, and you're telling them things in a way they are ready to hear for all kinds of different reasons. And then if you have algorithms that are just pushing people deeper and deeper and deeper into that web of inaccuracy, then people really can get misled. Just a quick word on AI, which has really blossomed since we wrote the book. There's definitely people who point out that chatbots can give good information, and AI can be used to spot misinformation, but also chatbots can reinforce very confused beliefs because they're trying to be your friend and have you continue to engage with them. And it's also very clear, as we see in all kinds of contexts, that AI can create misinformation at scale. So I'm not, super enthusiastic about the idea that AI is going to get us out of this right now. But it's going to be obviously a huge part of this information world. So the diagnosis here is information sick. For individuals, they can't find and believe accurate information about critical health topics, leading to risky and dangerous decision-making. For society, we're failing to support the institutions of journalism and science so that truthful scientific information can advance health and save lives. And so let's talk just briefly about the kinds of treatments that we're thinking about for this condition. And Joanne, maybe you want to talk about the journalism.
Well, I think one of the sort of bright spots is the emergence of the nonprofit sector. There are quite a few really very good and usually free nonprofit outlets that are very policy oriented. They're not, they're springing up all over the place. A lot of them aren't sustainable. They come and go. But others become, think about ProPublica. Think about how, I had friends who went, Pulitzer Prize winning friend from the LA Times who quit to go help start ProPublica, 12, 13, 14. I thought he was nuts. But so he's won 5 more Pulitzers. And ProPublica it's free, it's amazing. KFF Health News, what was Kaiser Health News, now KFF Health News, which I sometimes work with. They have big nonprofits behind them, but they're collaborating with local news organizations and doing really good local news reporting. There's the Trace, which covers gun violence. There's the 19th, which covers sort of women and reproductive health and trans rights. There's a lot of them. You can find them geographically. If your hometown paper's gone, there might be one that's replacing it. There's ICT in June Country Today has been revived, and so some of them are also reporting Capital B, which covers Black America. Some of them are really giving voice to communities that have been neglected or underserved. So there are good things, but overall, it is quite depressing. The national news landscape has gotten much worse very, very recently. The bloodshed at the Washington Post, not literal, but almost. And that was before, there were buyouts, didn't get as much national attention, but these huge amount of layoffs at the Post, the year before, there were deep buyouts. They lost a bunch of really experienced health reporters. The Wall Street Journal laid off a bunch of health policy people. They're still covering the business of health. They're not covering the policy anymore. I mean, a little bit of it will still creep in, but it's also often creeps in through a political lens, and people aren't getting the news they need. And I think that, one of the things that Josh alluded to, and it'll probably come up more in the Q&A because we're going to stop talking in a minute or so. Josh mentioned that misinformation is sticky, right? And that's the word that scholars and researchers who are trying to figure out how to combat it, thwart it. You think about any conversation you've had from somebody who has fallen into a rabbit hole, you can't, you can try everything. It's sticky. It's in their brains, and we really do not yet know how to get them out. We're working on pre-bunking and debunking, and there's lots of research. There's some things that are a little promising. We're not there yet. I mean, people who say they have the solution, just look around you. Obviously, we don't. It's getting worse. So, as we spend a lot of time, I'm a journalist at a school of public health. We have a lot of conversations both in and out of our classrooms on what is the solution. And it's a cliche, but it is in fact an existential crisis. So
I think we flipped through the slides. We do have some nonprofit news in Baltimore. We have the Baltimore Banner, which is just won a Pulitzer Prize for its work coverage of overdose. And I think, was it Philadelphia Inquirer?
Pittsburgh
Post-Gazette, right? The same company bought. These are some of the nonprofit sites that exist now. Joanne talked about some of the tactics. One of the most challenging sessions we had with students was with a actual fact checker for a major news service. And they described their job. They're like, oh yeah, I got a really juicy one, and I really want to, fact check the hell out of it. So it's like a week of research, and then they post the definitive takedown, definitive refutation of what was online. And then we're like, well, how many people see the refutation? And it's like, maybe 3,000, 4,000, 5,000. It's like, how many people see the original story? It could be like millions, And so it's like a huge amount of effort after the fact. And there's no guarantee that the people who read the fact check are going to be the ones who actually read the story or it changed. So, I do think probably some of the most interesting, types of responses are ways to essentially teach people how to engage with social media, help them do a better job, help them clean up their own information environments. But really, in our fields, both in medicine and public health, we really have to do a better job of winning the battle in real life. Being there, having clinicians able to talk about these things. And maybe they weren't doing it before, but now people are exposed to a really unhealthy information environment that the doctor or the nurse should ask them about. And in public health, we need to do a much better job having people from communities engaged in talking about key issues, hearing the information. We have to regulation and beyond at the end. Joanne and I panel at Yale Law School told that somebody would be on who was going to talk about the regulation of social media.
We were disappointed.
We were very excited going in there. She was like, no, there's nothing we can do under the First Amendment. That's a little bit of a maybe overstatement, but there's a lot of challenges with regulating social media directly. And I think more transparency, the ability to do more research, the ability to understand what's happening on these networks, bare minimum necessary to do it. Just to say, we also have parts of the book that talk about the implications for health departments. I had a health department, state and city, with basically one person doing all this. Can't do that now. Universities, we pivoted at Johns Hopkins during the pandemic. We previously were kind of a source of information to the field of public health. During the pandemic, we we had tremendous uptake on the different information sources that we put out. Whether a university is able to do that whole country all the time, certain issues, having the capacity to be a source of information for the local community, for local leaders, that kind of trusted capital that university had really needs to be. Clinical organization shouldn't just, hide Tiffany Joe. They have to realize that when people believe that vaccines work, partly what they're able to talk about. Their patients, helping not just train their clinicians, but also make the waiting rooms more healthy from an information environment perspective, and working with organizations and community to develop essentially. We do have recommendations for social media companies, including that they do a much better job explaining how their algorithms work. They should be transparent about their policies and which posts get replicated. We do support fact-checking and moderation from the inside. Some of it can be helpful. And we appreciate the attempts to surface high-quality content, but a better understanding of how people fall into decisions. It's very, very hard to regulate. You know, given the way that the government poured in the storm, may be understandable media companies to do. So it's very, very challenging. Even Europe, which is thinking about different kinds of regulations. So that is overview. We have a very serious problem with public health that has huge consequences. Health. There are some bright spots, but diagnosis is the thing and the challenge that we're all facing.
Do you have the slide with the discount?
Oh, yeah. If you're interested in the book, you can click on our
Johns Hopkins, there's a discount code for this price.
Yeah.
But I would add that if I covered Congress for something like close to 15 years, and I don't see this Congress regulating, partly because of legitimate First Amendment issues, but I also just don't think politically they're going to regulate the social media companies for all the obvious political reasons, including they're having trouble doing anything. The fact that Europe has done some of it, you know, that Facebook and or Meta and Twitter, they don't want to have, they can't. They're international companies. They can't have a portal that for Americans or within the continental United States and another one in France. So as Europe does regulate, they have regulated privacy. We have benefited indirectly on some of the European privacy. They have begun to regulate. Clearly, neither Josh and I are expert on European media regulation. Clearly, it's not enough because, I mean, they recently fined Musk something like $140 million. I may be off by 10 or 20. I mean, that's like asking me to pay you a quarter. And clearly, whatever they're doing, it is an important first step. If they ever get it right, it should help us. But I don't think they've figured out the balance of regulation for, you know, they don't have the same quite First Amendment that we do, but it's not an easy thing to figure out. I mean, Josh's comment on requiring them to be more transparent about their algorithms doesn't affect their content, right? But it would let us people who are studying disinformation and its spread and its stickiness, it would give them new tools to combat that.
All right. Well, we're open for questions. Thanks so much. It's okay to clap. I saw that half clap, but we'll take it. We'll take it. But we're really most interested, though, in your comments. So, thoughts that you all have? Yeah.
Okay. All these cogent points, information, logic, then there's money. And money being such a value system in our society, driving so much of this. I'm just curious with respect to just the fact that money is driving so many of these directions. If you have any thoughts about that from your perspectives as to what we do about it, I mean, directly, how do you, and how when you suggest some of these solutions, how do we attack the money problem?
Yeah. I mean, I'll just jump in and say on the disinformation side, you have disinformation, simply. really disinformation. People are sharing information. Probably know it's wrong. There is, or is flatly wrong. They intend to share it. And there are a few different categories underneath. There's state actors that are doing that. So that's not exactly money. It's like control foreign policy to try to confuse people in other countries and where the recipients of that. Then there are companies trying to sell products. Like, don't go to the doctor, just order my supplement.
There's some crazy stuff you can get even on Amazon. It's not just like weird science. It's like everywhere.
Yeah, and now some of that, there is potentially a regulatory angle with the FDA, and if the company's stepping over the line, you can go after that. It's hard because the companies tend to change, and they're generally not, major pharmaceutical companies. Really, never. That they're going to be companies that like shift, come at it different ways, but you can do some enforcement there, and then you have like people who are essentially in a movement. It's not so much they're selling a particular product, but they're really selling like a worldview about things, and it's not as tethered to an individual product where there might be some kind of clear regulatory response, and that's particularly hard, and then you have just a ton of influencers who are not actually working for companies. Some of them may be getting money, and so that might potentially be a way to regulate, but others may just be trying to drive their popularity by jumping on board. So it's really confusing. I think it's a great point, and there may be a more coherent regulatory strategy out there, but right now we're not seeing very much at all.
The Center on Digital monitors this for that. Some of you probably saw it during the pandemic. Was called the Disinformation Dozen, and monitoring it, documenting who the biggest domestic purveyors were. Because as Josh mentioned, I mean, it's not a conspiracy theory. A lot of it does come from Russia, North Korea, Iran. I mean, there are unfriendly countries are behind some of this, but there are some people who truly believe, in the product they're peddling. But there's some people who are making an enormous amount of money selling you things that certainly won't help you and may in fact harm you. And you're right, lots and lots of money behind some of these products and attempts to push these products.
And now they can program, 1 million bots while they're sleeping to send messages out to flood everybody's inbox.
Yeah, and some of the disinformation is now online. It's not just directed at all of you and us. It's actually directed into the AI engines. It is material it is fake news or false medical advice that AI is spreading, so that it is sort of corrupting the knowledge base. I don't know if you call it the knowledge, but whatever it is that that generative AI spews out. Apparently this is sort of coming from Russia. A lot of it's coming from Russia, and the Russia allies and the Russian contingent, pro-Russia contingent in Ukraine. So they're producing bots, not just to getting on our Facebook pages, but getting into the guts of AI, which is actually quite scary. I don't know how much research there's been on that yet on MIT.
You have a quick follow-up?
I don't want to hog the forum or anything, but just the fact that money as a value system is corrupting the very people you're trying to argue these points with, you're trying to get good information across, but people are seeing that the money, the decisions are made because more money is over here versus over here, so I must go with that. And to me, that was kind of one of the levels of my question.
Well, one of the things that the MAHA movement says, and there's no one MAHA definition. I mean, there are lots of people who would put the MAHA agree, because MAHA means a lot of different things, and so not everybody would fall under the same umbrella. But there are people who are leading voices in MAHA, and what they are saying is your doctor wants you to get a vaccine because he or she is going to make so much money from it. It's not true. Your physician is not making money off the vaccines. The vaccine companies, some of them, I mean, the Pfizer and Moderna made money. That's true. But that everything in the American healthcare system is corrupt because it's for profit. The people telling you that are making money. They're making a lot of money. And there is an argument about, what kind of healthcare system and how much it costs and affordability and access, all of which makes people more, if you can't get to your doctor because you can't afford it or you don't have insurance or you've got to wait 6 months, you might just use Dr. Google or Dr. GPT chat or whatever. And some of the information you're going to get is going to be good, and some of the information you're going to get is not going to be good. And it's AI has supercharged that. But there are fundamental access issues, which is partly ideological in our country, and it partly is money. So,
I think, yes.
In a way, what's happening is that individuals lives are not able, not know how to evaluate information. It's coming. Sources are. There used to be, there was a certain amount of regulation and validation that was done when there were a limited number of sources. And so, in some ways, there ought to be in education training for that's really almost required for every person.
Right. Someone I saw the third.
How to handle information, and there'll be controversy over that and so forth too. In terms of who's the legitimate source? I mean, that's the extension of this. Is there's no legitimate source.
Well, there are legitimate sources, but it's hard for people to know who they are.
Yeah.
Well, the National Academy, there was an international group that was working on who are the credible sources. They don't have the capacity to do it with each individual you can, Dr. X versus Dr. Y, but institutional voices. And Google for YouTube YouTube really cleaned up. Like when I was researching a story on the RSV vaccine 2 years ago when it was rolled out, and I went to YouTube expecting to find the kind of things I had seen the prior year, the year or two on COVID, and actually it was really clean. It was CDC, and it was Biden's CDC. It was CDC. It was reputable medical schools. It was you could find the information, but I had to really look for it. I had to go like 12 or 13 screens. Now there's a problem because sources that we would agree were credible, such as the CDC, they're much more problematic. Not everybody would think they're credible anymore, right? The other thing is like, yeah, I mean, I was, we told me this at Yale the other day. Someone said to me, about. I was on a grant review. It was a sort of informal discussion about grants. It wasn't and someone had proposed, college freshmen should get media literacy, and my response was it should be prenatal, we need to teach civics again. We need to teach critical thinking skills and critical skills that we've lost along the way. If some of you have friends, there's people who are uncertain are easier to reach than people who are really dug in, right? So in the medical community, you should be. It's not that you can never reach the dug-in person, but the people who are sort of confused and muddled are going to be more persuadable. So those of you who have friends and family who are persuadable, there are the Poynter Institute, which is a journalism research organization in St. Pete. They have some really good media, both for seniors who are really victim of a lot of financially motivated online disinformation, as well as for teens. So there are resources out there.
The problem is this framework is that it's on each of us to figure this out. And we had someone stand up at one of our talks and say, this is an unhealthy environment. That's how you're describing it. The solution is not to empower people with boots and waiters and, injections and medicines afterwards and screenings. You need to clean up the environment. Right? We don't just allow the lakes to get polluted and tell people to wear full body suits. We clean up the lakes.
Not anymore.
We got to clean up the environment. Why aren't you doing that? And it's really hard to clean this up. That's why we're in this situation. And I think the solutions that this particular person was excited about have no chance right now. As policy issues. There's a very classic public health teaching about communications, and this is going to be a really hard one for you all to reach, but it has to do with a tornado and a tornado warning. And the idea is that if there's a tornado warning, you're picturing somebody and they're watching their favorite show with their favorite snack on their lap and on their favorite couch, and they get on the news it says tornado warning, go to the basement, and then they get a phone message that says tornado warning, go to the basement. And then their mom calls and she goes, are you in the basement already? You're supposed to be in the basement. Then there's
I'm that mom.
right, reasonably good chance that you're going to go to the basement, right? But if you are watching TV and it says tornado warning and you get a note on your phone that says, don't believe, basement's not the safest place, and they're often very wrong on the weather service. There's no need to go anywhere. And then your mom calls and says, big weather is lying to us again, then it's much less likely that you will go, and unfortunately we're in a world where we're all sitting there, maybe not on tornadoes yet, but on a lot of other things, getting so many different things, and it's very, very hard to equip people individually to find their way through this. We can equip more people to find their way through this, but if it's unhealthy, it's a really fundamental challenge.
And one thing that happened this morning, I watched part of Secretary Kennedy's testimony before the Ways and Means Committee because it's part of my job, and I didn't watch all of it. I watched enough to get the flavor. And frequently when Democrats asked him questions about things that he had done or his department had done, he would just say, "That's misinformation. That's not true. You're spreading misinformation." So there's really also a weaponization. I think many of the Democrats on the committee would have liked to say the same thing to him, and it's a little harder for them to say that to a cabinet secretary in the peculiar conventions of Congress that are also deteriorating. But I mean, it was interesting to watch him wield that, and that was his comeback.
Other questions?
Yeah.
Just why he wielded that is because that works. Just like you stated, lies outrun the truth and they're sticky. So I was hoping for better what I can do about this. I'm a city council member in a small southern Michigan town. I moved from California 5 years ago. I lived my whole adult life in Los Angeles with a bunch of MIT guys. Education was always the key, starting when I was at Ann Arbor at 14. That was my epiphany. Oh, education solves everything. Well, we need to lie to everybody, just like the other side is lying, to get information to scare them, to make them do what we want them to do, sadly.
I don't know that that's going to,
I live in a small town.
Right.
I've been, for 2 years now, I've been begging anybody to talk to me about what you guys know about and what we all know about. Everyone's scared to even ask me a question.
One of the other things that I'm finding as a journalist is a lot of the experts are really nervous about speaking and being quoted, and not Josh. But, and actually with a colleague at Hopkins, we actually wrote something for a education publication about why why the academy needs to talk to us and what we need. And if journalists are under pressure because there are not as many of us and we're underpaid and overworked, if we're going to get things right, we need the experts to help.
Yeah. What is the information? How would you describe the information environment where you are?
I understand media, I did social media, I did games to get you addicted, I did all that stuff. And people are just so ignorant, they don't know. No one knew what Citizens United was on my city council. Nobody, no one in town has yet been able to tell me. People say, oh, I belong to lots of organizations. When I bring up Citizens United, I have no idea. They aren't following. The silos they're in are ridiculous. Just on the radio the entire way up here, 45 minutes, some Detroit station just spewing unbelievable lies and misinformation the entire time.
We can talk to you. If you can hang around for a few minutes, we're going to be here. You've been trying to answer. You've been trying to ask. But well, I'm happy to talk to you because I don't have all the answers. I have some resources.
Yeah, I wanted to know if you care to characterize what big philanthropy is doing, whether friend or foe.
Well, I don't know that there's one such thing. There are all these nonprofits that are boiling up or bubbling up. A lot of them are philanthropic. There's good philanthropy helping media. A lot of these groups, like these small, like the Trace, like the 19th, they're donation backed. Some do have subscriptions. They're heavily philanthropy backed. And there's a bunch of philanthropies dedicated specifically and big philanthropy as well as smaller, more grassrootsy nonprofits really working on local news. I'm involved with several of them in various, limited capacities. There's nonprofits that are working on solutions for misinformation. There's a movement in public health. I mean, once it's, as we've said, you've heard us say several times, it's sticky. So how do you get to people before they get stuck, right? So there's some interesting work going on to track the misinformation pretty much in real time, and then try to get that out to those who need to know it, whether it's government officials or health officials, et cetera. Again, it's still evolving, but is there some money behind it? Yes. The Knight Foundation is doing, Newmark.
Yeah.
There is money. There is good money. Yeah. There are a number, KFF, which many of you still know as Kaiser. They do a lot. I mean, they have KFF, but the KFF, not only does KFF Health News do good work, but they're also, the fact that they're partnering with local papers and regional papers, like their Denver initiative and their St. Louis initiative, that's all state philanthropy. So yeah, I mean, I would say that philanthropy is important with the media right now.
The media philanthropy is very critical. The health philanthropy naturally tends to focus on a particular outcome rather than the underlying condition. So I think health philanthropies have been slower to invest in, helping health departments or even health and medicine do better in this environment. I think it's more like we've got one that's interested in, particular cancer, maybe there's, or another that might be interested in, all good issues, all requiring resources, and this is more abstract. So yeah, I think this underlying issue gets less attention. Yeah.
Yeah, I'm a computing person, so please don't hate me for this.
Maybe you could fix.
So let's go back to your environment, the thing which you talked about. So isn't it true that in the current environment, it is the cost of publishing news is very low? So is the problem with the environment that we are not able to find the useful information for a person? Or what do you mean by cleaning? So can I think of it more as finding the information rather than cleaning up the mess which is there?
Well, yeah, I was sort of explaining what this particular person at our talk, what his perspective was, which is kind of an interesting way to think about it. I think the challenge is that people are signing up for algorithms. They're joining these groups, willingly. They're not thinking, I need good information, let me figure out how to get it. They're signing up, I trust this person, I trust this person, I trust this person, and then that's bringing with it all this information that's served up to them. So it's challenging. It's challenging, I think we're still at a point where if people really want to get, information they can trust that's sort of from the more mainstream side, they can talk to their doctor, that there are things that people can do. But a lot of people are not even in that world, and so even to say like, you're having trouble finding good information, I'm not sure they would agree. I would say they're having trouble. But my diagnosis is that they're information sick. Their diagnosis is they've got a great feed on their Instagram and they're learning a lot. And did you know that there's a new peptide that will help cure your cancer, or increase your muscle mass? And like, that's great information to them. So they don't necessarily appreciate that as failing to get good information.
So you're right, the cost of putting out social media information is, you get to sit down and do it, right? The cost of media is they're going broke. So they're closing, they're cutting back. So there's sort of an extra, which is vetting and expertise and editing and distribution. And so, I mean, some of the checks aren't there. There's very few newspapers have have a lot of copy editing anymore, fact checking, because they can't afford it. So it's the one thing that I might welcome AI in a newsroom is the copy editing, like spell, that, but with a human being then checking, the last eyes should be human. But because if there's zero copy editing, I'd rather have a computer checking my commas and semicolons and spellings and names and all that stuff than getting, than nothing, as long as, I mean, how much newsrooms have been gutted is really remarkable. When Josh and I needed a speaker for our class, one of the speakers of our class and I wanted a local journalist. And I went on to the membership of the Association of Healthcare Journalists, and there are like hundreds of us. And I tell you, I went through page after page after page after page after page, clicking to find a local reporter who was not a freelancer. And when I finally found one, and she's great, she's at the Seattle paper. and she came and she talked to, she zoomed in with our class, and she's in the book.
Foundation.
But she is funded by Gates, the Gates Foundation. So in Seattle, if you're in Seattle, Gates is supporting an education team, and I mean, they may have changed since I looked at the details, but at one point there was an education team that Gates was paying. There was a healthcare team. She was on a mental health team with 4 people that Gates was paying. Who has 4 mental health reporters in a mid-sized paper? Nobody, unless Gates lives in your hometown. There was investigative, there was all sorts of stuff. There's a wonderfully creative, community-supported, small donor, philanthropic supported investigative project in a small newspaper in South Carolina, which we have in the book. And it's called Uncovered, which is, think about it. And it's also Charleston, a different Charleston, South Carolina. A pretty small paper, family owned again, and they couldn't afford to do investigative work anymore. They had to just drop it. And someone said, let's try to raise the money in the community. They were overwhelmed with the amount of work they got. And they collaborate with even littler papers, some of which has been health oriented. A lot of it's just plain old fashioned corruption. Because when your local newspaper goes away, what happens? Corruption goes up, spending goes up. No one's watching. It's not good for us. Voter turnout goes down. It's not just health, it's damage. It's not just that you don't get the sports scores. You can get that online. But it's bad.
Just to the point of being a computer scientist, you could imagine creating a way for people to get better information and then trying to get as many trusted people as possible to endorse it. Maybe there's a special algorithm that you could say we want all the social media companies to offer, and people should be able to choose the, purple button or whatever option that then surfaces better content for you. I mean, the things that you could imagine, it's just, it's a very difficult challenge to figure out how to get there. And the harder part is probably not the technical part.
So, regarding the Gates Foundation's one, I think the question I have is, isn't it true that now we don't need a Gates Foundation for good local news, but it is difficult to find it? I absolutely agree.
I think we do.
No. 2 to 3 local newspapers are closing every single week, and that's been going on for years. Huge parts of the country have 0 local news, and the local TV station is now owned by a national chain, and it's increasingly likely to be Sinclair, which is overtly conservative. They don't hide it. They do not try to be objective. They require their anchors to read commentaries written by headquarters. That same guy who owns Sinclair now owns the Baltimore Sun. So no, small town papers, mid-sized papers. There's a great article in the Atlantic, I don't know, 5 or 6 years ago. The Chicago Tribune was a legendary paper, just a great paper, other than their very famous mistake in the 1948 Truman election. But the best paper in the middle of the country, right? And a famous skyscraper, those of you, you've all seen it in Chicago. The Atlantic writer went to visit it, described going down to the basement of what had been the Tribune headquarters and finding I still remember his words, it was finding a newsroom the size of a Chipotle. And that's the biggest paper in the Midwest. Or it was the biggest paper in the Midwest. So no, I think that is there stuff on social media or Substack that's true and accurate, and they had their best friend or their spouse read it to make sure they didn't make mistakes? Yeah, there are people who are writing responsible stuff, and there's an awful amount of garbage. And to have something that's vetted and published with some kind of standards costs money, and the American people don't want to pay for newspapers or magazines, and that's why they're going broke.
Right.
Am I the last question?
Was there a signal? Everyone of course is invited to the reception. So when we're ready to continue the conversation there.
I think they're too quick. Well, we'd have two quick. There are 2 here. Too quickly.
So I wanted to share that ISR for last year has had our first journalist in residence, supported by Jim House. Thank you. And his name is Tim Alberta from the Atlantic, and he's been thinking very carefully about the erosion of trust at the institutional level. And so we've been, collectively discussing what is trust, and what does it mean, what is mistrust and distrust, and I remember one of your slides, you had flagged trust and sort of signaling that it's trust at the institutional level. And so just thinking about what it means to rebuild that trust, and I think both in the healthcare arena and in our journalistic endeavors, there's been such an erosion of trust. And And my concern is that with AI and other forms of, as you described with fake news, that those aren't things that are going to assist us, right, in rebuilding that. I just wondering.
And there's, Josh will speak to this too, there's a huge amount of commissions and conversation and thought about, I mean, in our world, it's public health, but it's true of everything, right? I mean, and the polarization in our country which is not going to go away anytime soon, has undermined trust for others. So are we aware? I mean, I work at the intersection of public health and journalism, right? Or healthcare, public health and journalism. So I'm being hit by distrust from many directions. There's a lot of awareness of what you said. There's a lot of conversations, a lot of research, there's a lot of thought. I don't think that any of us, I mean, but I also don't think there's one solution. I don't think there'll be one solution for trust. I don't think there'll be one solution for disinformation. During the pandemic, we talked about Swiss cheese, right? Remember that? Public health, you need a mask and you need a vaccine and you need this and that none of them are perfect, but if you put them all together, you had a nice, the Swiss cheese. And I sort of think that that's going to be what helps us with disinformation.
Yeah, I would just say that the assumption that we control whether we're trusted is probably wrong. We can affect it, but there's some underlying challenges with society, which is why this trust issue is all across institutions. And one of the underlying challenges, and with the current information environment, it is a nuance. The very role of public health, I think, rests on that it's there. It may appear, and very well maybe people may feel like we did it all to ourselves. I don't think. I do think there were mistakes made, but I don't.
To me, it seems like the goal is just to keep everyone confused, because the more people are confused, the less confused, the easier to control, the more money you can make, and the more you can control the population. Do you have anything to say about that? Because I myself, if I see something on Instagram, I'll go find the news article that's related to what I saw, and dive deeper into it. For Wall Street Journal, New York Times subscription. So I do my diligence, but not everyone has the time or wants to do it.
What he was saying in his community, no one, apparently he's the only one.
Stay confused, and I want the information, but it doesn't seem like many people have that same.
The goal isn't necessarily confusion per se. It's lots. I mean, the sources of misinformation, it's money. It is some foreign enemies. It is some people who are true believers who aren't in it for the money. They really genuinely believe that that raw milk is better. They're wrong, but they think it. They may not be making a lot of money by selling raw milk. So there's a tend to confuse, and some confusion is the outcome of other motives, and there are many different motives, none of which are. I mean, some people who believe wrong things mean well, right? I mean, not everybody who sells you something wrong is trying to sell you a used car, right? But there's a lot of malevolence behind it, and fear spreads faster than hope, unfortunately. The misinformation we talked about, the emotional content, and I think this is the last thing I'll say, and we'll go in the other room, is it's not just emotional content, it's negative. Like disinformation or misinformation, it is hitting you on your fears, your anxieties, your resentments, your insecurities. And there was misinformation, and we all have those things, right? That's part of being human. Misinformation existed, disinformation existed before the pandemic. But how did we feel during the pandemic? We were confused, angry, afraid, maybe not afraid for us, but afraid for our maybe older or younger loved ones, isolated. It was like the perfect breeding ground. So there's no counterfactual, but do I think that disinformation wouldn't be this bad if we didn't have a pandemic? Maybe not. I mean, who knows? But I think that, if you were going to sort of create the hypothetical breeding ground for where disinformation can grow, pandemic is a really good environment. In an election year, right?
Well, the converse of that, I'm dedicated to the last thought, at least 10%. The converse of that is that as things get a little bit better, and then we have a chance to turn that cycle around. And we're seeing historic decline in violence, for example, gun violence. There are different parts of progress being made. There are different advances in medicine. We have opportunities to build trust, turn around some of those things. You know, the fight we have to take on to get the
And someone asked me about my glimmers of hope the other day, and I said maybe I was being too Pollyanna-ish, but I actually, when people ask me what do we still unite around as a country, I always say, maybe the Super Bowl, but I think Artemis. There are people who are going to tell you it's fake. There are people who don't believe in the original moon landing, and there are people who won't believe in this. But I also think that it was something that brought many people together, and I'm hoping, and I also think it may have made people marvel a little bit about science, particularly the next generation. I think some of those kids looking up at the sky will be changed. And is it going to fix the world? No, but like Josh, do I want to leave you with something hopeful? I actually think that was hopeful for more than just the pure science. I think it might have